This is Mina Malapeti with the Seamless Connection podcast. Thank you for joining us for another afternoon together. And I have with me here today Wei-Li Shao, President of Omada Health, as well as a whole host of healthcare experience from the pharmaceutical sector all the way through digital health to where he's working in today. Thank you so much for joining me today, Wei-Li.
Thank you, Mina, for having me. It's an absolute pleasure to be here.
So I'm going to let you introduce yourself in more detail to the audience because you've had a wealth of experience in a number of different subsectors within healthcare, which is unusual to say the least. People usually stick to one and kind of go deeper and deeper and deeper. And you've worked across the board from actual drug development and understanding the pharmaceutical industry and the processes there, all the way through to what are the implications of that for managing patients on such drugs and making sure that they're staying compliant enough to see the benefits of that through your work at Omada Health now. So I'd love to hand it off to you to give a little bit of a deeper background on what's brought you to where you are today, and then we'll dive into everything deeper.
Awesome. Yeah. Thank you, Mina. I appreciate it. So I started out in healthcare quite some time ago in the biopharmaceutical industry. And it was an incredibly rewarding experience. It gave me my first real exposure to chronic disease, things like obesity, diabetes, high blood pressure, basically all cardiometabolic things, as well as a whole bunch of other stuff. And what led me to Omada, and for those of your listeners maybe that are not as familiar with Omada, maybe I should just say a couple of words on Omada first. Omada can be best defined as a virtual first healthcare organization that really, really focuses the value we provide in this space in between doctor visits. And that's super important, as we all know, because 80 to 90% of all the outcomes, whether they're good or bad or neutral, occur in that space, not in the doctor's office. So that's kind of where people need that persistent kind of care and help. And so we use data and the insights from that data and technology to scale a virtual first form of care for chronic diseases, focused in cardiometabolic diseases in that space in between visits. So that's kind of a little bit about what Omada does. And that's, I guess, important insofar as my introduction that, there was probably one seminal event, Mina, that I share with people that brought me to where I am today. And it is essentially goes back to almost a decade ago where I was in biopharma and was running our diabetes business and was visiting a number of diabetes clinics around the country. And the disparity in types and levels and quality of care you get in China really, really vary geographically. And through all that, I concluded that the only way to accelerate the form of diabetes care that everybody aspires to want and need in China to match the rate of growth in diabetes in China couldn't be done through the regular educational in-person, one doctor at a time means. The only solution to me, at least, was technology. And so my team and I had that revelation and called up Tencent, who runs WeChat. And essentially the dialogue was something around hey, how do we build a diabetes connected care platform on the WeChat platform? Because everybody across China as well as Asia uses WeChat, as we both know. And so we did that. And so long story short, in about a year and a half, we built our MVP with Tencent, and hundreds of thousands of patients kind of came in and pulled in. And that really just kind of widened my healthcare aperture and showed me a side of healthcare and what was possible. And so long story short, that's what has eventually brought me to Omada, was just that real seminal realization that maybe there was a better way. And maybe there was a way to provide persistent care, what is now we refer as in between doctor visits, especially with chronic conditions. So it was a hugely inspiring event. And I guess that's what created the formidable foundation of where I am today at Omada.
No, it's fantastic. It's a if you build it, they will come kind of philosophy, right?
Yeah, I mean, we've learned since then that, of course, nothing is like that. But it does, you have to build it before people do come. And so there's a little bit of that.
Yeah, exactly. One of the things that we've seen with digital health over the last few years is the acceptance of it, not just from a patient perspective, which obviously there's been many inroads made there, but also from an insurer and employer perspective of understanding the value. Do you think that was largely driven by COVID, the same way that acceptance of telehealth broadly was, or in terms of just the way that the industry is evolving and the way that people are now looking at value-based care, which is very different from our historical fee-for-service structure, and people are potentially looking at different avenues to capture value of care. I mean, I'm always curious as to, you know, for us from an Amplify MD perspective, when we talk to hospitals, health systems, some people get it and some people don't, in terms of what is the value of preventative care? What is the value of engagement with the patient? And when in a fee-for-service system, obviously, as you know, there was no value associated with that in a dollars and cents way. If it didn't hit a CPT code, it didn't count. So how are you, I guess, working with the new regime, if you will, of now value-based care has started to come into being? And I don't know if Omada actually plays in that purely, if you also offer a fee-for-service offering, but you clearly offer a value proposition for employers and for patients that reduces the overall cost of care. So I wanted to see kind of how you were interpreting the acceptance of that, when before people were like, what is that? Like, we don't care about that.
Yeah, it's a great question, and Mina, what you said in the lead up to your question, I agree with. If you were to summarize a very complex condition state in terms of what healthcare and virtual care, I think you described it impeccably well. So much behind what you said, by the way. But I think that certainly the really, really thin silver lining of the pandemic was that it brought the idea of virtual care to the masses. Not in the way that we all wanted it, but that is the very, very thin silver lining of this whole pandemic, is that's what it did. And that created, I think, mental openness for people to say, hey, I've seen it, I've experienced it, it works. How might we really leverage this in our traditional in-person healthcare system, or complement it or supplement it? And certainly value-based care, I think, is creating a unique opportunity for that. Value-based care, of course, has been tried a number of times in the history of medicine here in the United States, as we both know, over the last several decades. I do feel like it's different this time because there are economic structures in place. There are incentives in place for certain things we know are important for virtual care and preventative care. So I do feel like it's different now, and I've never been more optimistic about it. As it relates to Omada, we are firm believers in value-based care, and I guess I would offer two things to kind of put some context around that. The first one, we like to think that we have always been practicing a form of value-based care in the virtual setting since Omada's inception, over a decade ago. And it started like the following. So, for the majority of that last decade or so, the way we got paid for our diabetes prevention program and our weight management program actually was that we didn't get paid unless you lost weight. And so we actually had a sliding scale of payment. It was really complicated, hard to execute. But people loved it because for the first time at scale, they were saying, finally a healthcare organization that's providing, like, you get what you pay for what you get. And that was something that has become part of our reputation in the marketplace. And even today, I would say the majority of what we do has either that component or an additional component around performance guarantees, whether it be levels of engagement or total population outcomes. And so we've been, for a long time, huge proponents of the concept, but it's not been easy because all the infrastructures you mentioned hasn't really always been there. Fast forward to where we are today. Earlier in the year, we launched a partnership, and this is just one public example, with Intermountain Healthcare. And as we all know, they're super innovative. They're super future forward thinking. They provide incredible levels of service and care. Their NPS scores are super high. They also do a lot of at-risk business with the patients that they care for. And we entered into what we call probably one of our first of several modern value-based care agreements, where we share risk in a more contemporary format of a total population improvement on outcomes specifically in diabetes. And so we've been hard at work with them. They've been hard at work with us in really putting in this interstitial or in between care form of virtual care visit to complement their in-person visits, and a true value-based care platform that links to the contracts they have with their paying entities or their health insurance plans that they work with. So that's super exciting. And I think that is a very, very contemporary, optimistic example of what can be at scale.
Mm-hmm. No, and that's fantastic to hear, because one of the biggest issues with patients in a chronic care condition is engagement and ongoing engagement. It's because it's not something over weeks and months; it's over years.
That's right.
And sometimes they just don't want to hear from their navigator anymore, right? So how do you guys deal with that problem at Omada, which is to drive continued engagement from the patient? Because when you have high blood pressure or cholesterol or diabetes, or take any number of these that cross multiple specialty areas, there's a lot that they have to control. And if they're taking numerous pills, have numerous interventions, numerous doctors, do you ever get patients that are just fatigued and they're just like, I'm done? And how do you get them to re-engage if they get to that point?
Yeah, another incredible question. I think everybody can tell by the nature of questions that you're like in the healthcare weeds because you've got your questions are like super on target. At Omada, we kind of define this broad concept of engagement in kind of three different components, and they're super important because they're different in each of the regard along the journey. The first one is actual enrollment. What percent of people that you reach out to, that we partner with a health system, health plan, or employer actually enroll. The second one is we call activation. What is it that they're doing or not doing with us in the very initial period of that time, probably the first 2 or 3 months? Because we know if you're not engaged then, you're not going to be engaged later. So that's another important piece. And then the third one is probably the longer term, like after a year. Are they still engaged, and how has that engagement changed with the acuity of their disease? If it's gotten better, we do expect lower engagement, not as much care needed. If they've gotten worse or life circumstances, they need more support. So we look at it on that continuum, and not surprisingly, one would probably conclude, okay, well, we try to engage in that way along the arc of those three things over a member journey. And so, I think the concept of engagement is probably one of the top three hot topics right now in virtual care. The first one is on the enrollment side. We know through millions of member outreach deployments, we do thousands of partnered deployments to prospective members, every quarter. And we know that when we partner, when we lead the outreach, because we have tested this stuff through just iteration, a lot of insights, we know what needs to be said and how the program needs to be described in the right way for somebody's interest to be piqued and a likelihood to action, which is enrollment. But that, in addition to whether it be health plan advocacy through their own channels, their own navigators, if it's a health system through their own patient portals like MyChart, if you get that integrated approach, you get outsized engagement, 2 to 3 to sometimes 5x the baseline. And I think that's super critical. Maybe not surprising that lo and behold, an omni-channel approach works. But in healthcare, in this context, that omni-channel approach compared to like consumer packaged goods is still nascent compared to the science they figured out. The second one is around activation. Once they're inside our virtual care doors, there's a series of things that we know pay off. We know from millions of interactions and now over 1 million all-time members that if they just set a very specific SMART goal, it doesn't need to be big. In fact, smaller is actually better. We know that they're 250% more likely to achieve their engagement outcomes results 6 months later. It's remarkable. The correlation in R squared on that's massive. Then the last one over time is we find over a period of time, there's about 31 touch points per week that an average member has with Omada. And that ebbs and flows, like I said, based upon the acuity. So it's really about us working with our members in a partnership way with our care teams. What micro goals are you setting that incrementally get you to the big goal? And that's really boiling down the science and the art of behavior change in a very simplistic, probably not doing it justice way. But that's really what that longer tail of engagement looks like, is such that we do that and we help people work towards those smaller and smaller goals using a variety of behavior change techniques that we've scaled virtually through technology.
No, that makes sense. And one of the things that comes to mind here as you talk about the omnichannel approach, as we all know, our country is aging, and the population's getting grayer, getting sicker, with multiple comorbidities, which presents a great opportunity for companies like Omada. My question is, because I see this with my grandparents, getting them to successfully be compliant and adherent to their treatment plans for whatever condition they might have. It's a family approach too. So it's omnichannel from a tech perspective and from a resource perspective, but also from a support structure perspective beyond what we can provide from a third party perspective, right? So have you already taken steps? I know this is a relatively new area for a lot of digital health companies to involve the families or involve the community more to get that level of engagement, where once you can't drive or once you can't manage your own appointments, or maybe you can but you want someone to help you understand what the doctor's saying or what you have to do to maintain that. There's so many different levels, right? So I'm curious as to, does that have a role for something like Omada, and if so, how would that be incorporated? Is it does the family join the care team? Is it a separate kind of offering, and how do we think about that? And again, from a very personal perspective, because I have two aging grandparents who are at that point where they literally have, I think, on average between the two of them, 2 appointments a week, right? And multiple calls and multiple prescriptions and multiple exams and all of that.
Yeah, I think it's another great point. I mean, community or family support, we know is super important. If we look at kind of like the 5 or 6 key ingredients to successful behavior change in that space between doctor visits, one of them is community. I think community is another aspect of virtual care that is getting a lot of attention right now, alongside the things we mentioned, as well as like artificial intelligence, GLP-1s, and all these kinds of things. So it's right up there in the topical list. As it relates to community, I would say maybe a few things. The first one is that we have found that to be true, and so we have hundreds of specific topical communities within our care program. Right now, it's about member to member, peer to peer support, because we know that involvement in communities breeds and advocates behavior change. And they ask questions to each other, all sorts of things. And then our care teams monitor that and provide evidence-based replies to as well. As it relates to bringing in family, that is something we've talked about quite a bit, and is something we're actively investigating kind of in our next phase of how we personalize our program. The last thing I'll say on kind of that Medicare age population or the more senior age population is, interestingly enough, we did a fairly large scale study in the Medicare population, and they are more engaged than the younger population. There are all sorts of hypotheses as to why, but one that we debunked was that it wouldn't be less due to technology adoption. We found that they were actually quite facile with the technology we used, and that maybe because they had more issues or maybe more time, or had a higher need for community, that they were actually more engaged than the average member in their 40s or 50s, when looking at kind of that 65-year-old group or above. So that was like an interesting insight, and so not surprisingly, we see the outcomes follow that.
No, that's fantastic. And I know we're getting up here on time, but my one thing I want to definitely have a chance for you to speak on is, what are you most excited about as you look forward for Omada? There's so many areas you guys could push into, whether it's from the employer side, whether it's from the patient engagement side, whether it's, so we talked about implications of Insight Labs using AI to drive better engagement, better outcomes for your patients, whether it's all these new drugs that are coming out, whether GLP-1s or otherwise. I'm sure there'll be more next year that we can all talk about. So what are you most excited about, or does it all just come together and you kind of take it as it comes?
I think if I were to break it down, they're all interrelated. There are like 3 things I'm super excited about. So in brief, The first one is kind of what we do, what our core is, and the value we provide. Um, we're in the chronic conditions of cardiometabolic disease, MSK, behavioral health, and they're all the ones that are not only comorbid and interrelated, but the ones that everybody most right now, from a buyer standpoint, and have been historically, and we believe in the future, care about the most because they're meta mega population health issues that are consuming a lot of a cost as well as affecting a lot of people. And so we're excited about where we are from a positioning standpoint in the marketplace. We've never been stronger. We feel that, and that's great. The second one is, as I mentioned earlier, we crossed our 1 million member mark. And the reason it's exciting, beyond the fact that it's a high number, but that's less of the point, is that we have this huge database of textual data, contextual data, that allows us to apply generative AI and ML models on top of that, that I think will confer a huge care advantage for us going into the future. And so we're super excited about that. The third one, of course, is the positive disruptive technology of GLP-1s and the pipeline of GLP-1s. We believe there's a huge synergy between what Omada does and those disruptive, positive technologies that, when used in conjunction, can really, really bend the curve at a total population level for cardiovascular or cardiometabolic disease. And so we're active in that. Lots of discussions, lots of momentum. There'll probably be things to announce next year on that. But I think that that's the third area that we're super excited about. So in sum, in total, we probably couldn't be more excited about virtual health right now, and the promise and the idea of what it can provide to healthcare. And we feel super fortunate and humbled to be, I guess, a player in that huge movement.
That I can't wait to follow the journey and to see where you guys are all coming out at about a year from now. So I'm definitely planning to circle back with you at that point, because all of those hit on so many key areas that I see every day, not just my personal life, but in the professional life, in the hospital setting, in the outpatient setting. So you guys are working on some really critical aspects, and the critical diseases, quite frankly, that are costing our system way more than they should because they're not managed appropriately in between appointments. So thank you for that.
Yeah, no, thank you. And I appreciate you having me on your show, on your podcast. You've got a history of having great participants alongside you. So I'm humbled just to be part of that crowd.
Well, thank you. I appreciate it.